Hello, everybody. I'm Paula. I'm Dr. Moral from Vida Fertility, and I want to explain you a little bit of the fertility treatment in Spain. As already Tatiana told you, Vida Fertility Institute is a reproductive medicine center located in Spain, Europe, and it has two clinics, one in Madrid and one in Alicante. First of all, I want to make clear what is the ovarian reserve. The ovarian reserve is the number of oocytes that a patient has in a specific moment of her life. It gives us a lot of information because it informs us of what do we expect from a treatment, how many oocytes are we going to have if a patient goes under a treatment, and also which is the specific dosage of medication that we have to put her. This marker is a combination of three factors: mother's age, MIH, and antral follicle count. When the relation between mother's age and the ovarian reserve is that the older we get, unfortunately, the lower ovarian reserve we have. And with the other two factors, MIH and antral follicle count, the higher these markers are, the better the ovarian reserve is. These three factors speak about the quantity, how many eggs do we expect, but also mother's age speak about the quality. This means the quality of the ovocyte is how can the ovocyte be fertilized, if in a good way or a bad one, and the probabilities of developing a healthy embryo who can implant in the uterus. In this picture, it's shown how the quality and the quantity are both lost, especially from 35 years old, which is when it's the decreases is more pronunciated. And here in this other picture, we can see, speaking about the quality, the most known syndrome is the Down syndrome. The Down syndrome arises from a bad quality of the oocytes. It's also more pronunciated or more frequently when from 35, 36 years old. Okay, speaking a little bit about the treatments, I'm going to explain you how do we get the oocytes. In a natural cycle, women only ovulate 1 or 2 oocytes. But since we know that the success of the treatment is higher if we get more oocytes, because not all the oocytes that we retrieve are going to be useful for fertilization. Some of them will be immature, some of them will have genetical diseases. So not all of the eggs or the oocytes that we get are going to be useful. And that is why we want to have as many eggs as possible in order to find some of them which are healthy. For this purpose, we are going to give the treatment, which are hormones that our body produces every day, but are higher dosage. And we are going to perform ultrasound controls to see how the follicles are growing, and when we expect that the oocytes are mature and we have a great number of them, we will schedule the follicular puncture. The follicular puncture is done in the operating room. There will be an anesthesiology to sedate the patient so that she doesn't have any pain. And the oocyte retrieval will be done with the ultrasound and a needle. And that way we get the oocytes. We will give the oocytes to the biologist, who will look them under the microscope and will definitely tell us which of them are mature and useful and which of them cannot be used. In this picture here, the first oocyte is a mature one, but the other two ones are not mature, are immature. When we have our mature oocytes, in vitro fertilization can be done. Nowadays, it's very common to do ICSI, which is to force the entry of the sperm inside the oocyte, as shown in the picture. And when fertilization has been done and we have our embryos, we put them into a culture and we let them grow and develop. We are watching them daily and we are updating you with the latest news of your embryos. And hopefully they will arrive to day 5 or 6, which is the best moment to do the embryo transfer. In the embryo transfer, the patient is awakened and she's watching how we put the embryo inside the womb because we are controlling it by ultrasound. We can place inside the embryo, inside the womb, 1 or 2 embryos, depending on some characteristics of the patients or the embryos. Okay, what are the solutions when we have a patient that has a bad ovarian reserve because of the age or because of other problems? When having a bad ovarian reserve, as I told you before, bad quality of the oocytes is also expected. Therefore, we can perform a pre-implantational genetic test, which is called PGT-A, and it consists in when we have our blastocyst in day 5 or 6, we take 5 or 6 cells from the more exterior part of the embryo and we analyze them. We watch the chromosomes and we select those embryos who are euploid, which is also, they are the healthy embryos. This information is very valuable for us because that way we can avoid transferring a non-healthy embryo, which will only lead to a negative pregnancy test or a miscarriage, a bad result. This is an example of how the results of the PGT-A are shown. Another solution would also be egg donation treatment, which is, as I told you before, it's a solution for patients who have low quality or low quantity or they have undergone some IVF cycles with bad results. At the end, what patients want is to form a family, and this is a solution for patients that cannot use their own oocytes. Since we are transferring embryos from patients who have a better quality, the probability of having genetically healthy embryos is higher. In this case, the patient, we don't have to retrieve the eggs of the patient, the oocytes, and we will only have to prepare her womb, the uterus. This is done by also taking hormones, are the same hormones as our body produces in a natural cycle, and the controls are also done by ultrasound. And when we see that the uterus is prepared, we can transfer the embryo, as I explained earlier. The donor selection, the egg donors, are women under 35 years old. We get to know them because they come to our clinics and we personally know them, and we select who of them can don their eggs. They have to pass some tests. They have to pass tests for sexual acquired diseases, genetically tests, and they have to pass a psychological test. And if this is okay, they can donate their oocytes with us, and then we select the perfect donor for the couple. This selection, we do it attending to some characteristics of the patients. of the color of their hair, the color of their eyes. This is the way. And it's important also to know that the donation in Spain is anonymous. Just finishing, I just wanted to speak a little bit about receptivity issues and the importance of the window of implantation. It is well known that there is a communication between the embryo and the inner part of the womb, which is called endometrium. And this communication is a very delicate process that has to be done very carefully. This communication has to be done within some specific days of the cycle. And if it's done, the embryo arrives to the endometrium earlier or later than these days, we won't be successful and we won't achieve a pregnancy. There are some, for this purpose, there are some tests, for example, the ERA test, that are done to know precisely which are the days that this communication has to take place. Okay, and that was all for today. I hope I explained it good for you, and if you have any questions, I will happily answer them.
So thank you, Paula. So one typical question is like, we have here a question which is, so how long do we stay to stay in Europe for all the treatment? Is it like very long, or how long is enough to do like an IVF treatment, for example?
Well, since some of the controls can be done in the patient's country, for some ultrasounds can be done at home, and they can send us the results. So at the end, it's about 1 or 2 weeks, the time that they have to come to Spain to finish the treatment.
And also for the egg donation treatment as well?
For the, yes, because it's the time that they have to be here for the transfer.
Okay, we have here another question which asks, so, are all our donors from Spain?
Sorry?
All our donors from Spain. This is a typical question, yes, actually. Yes, because well, Spain is in Europe, but we have like so many different nationalities here in Spain, and also the phenotype, which means so the characteristics of the skin and eye colors and so on. So I don't think that all our donors are from Spain, but so maybe you can clarify.
Yes, well, they usually live in Spain, but this doesn't mean that they are Spanish people, because some of the donors are from other countries and they are currently living here.
That's great. Yeah, good. So Jennifer, do you have any questions? I know you know a lot of IVF treatments and how the procedure is. So did you find something interesting in this presentation from Paula? Which,
I thought it was really helpful to sort of see the illustration of it. I know that a lot of times for my clients, they really, you know, if they're doing IVF for the first time, they're looking to understand the cycle and how it's going to proceed. So it was helpful to sort of have this kind of day by day of what's going to happen at the different parts of the cycle. I was wondering if you or Paula could answer if somebody is interested from the US in doing fertility treatment in another country, like doing fertility treatment with Vida, what sort of, how do they get started?
Well, the first contact.
Well, the first step is always the first contact by email or by phone. So, you know, when the patient contacts us, we explain them our treatments options, and we always recommend to them to have a initial consultation, well, with our specialists, because it's very important to get to know the patients in order to create some personalized treatment plan and diagnosis, exactly. So the first step is always the initial consultation, and well, the doctor is going to study the case. She's gonna recommend maybe some testings to do at home. And yes, as Paula mentioned previously, you always start the first part of the treatment at home. So the controls, you get all the medication. Actually, it's easy to get the medication nowadays because there are lots of pharmacies online.
Right.
So it's easy. So the patient, they order all the medication, they start all the preparations at home, whether it's for the egg donation or the IVF, and we will need them to be in Spain. Well, we're gonna tell them the exact dates to be here in Spain for between 7 and 12 days, well, depending on the treatments patient has.
And they will know exactly. So I don't know, like 3 or 4 months already.
Exactly.
Ahead. So when exactly they have to come, right? So
exactly. So they have time. They have time to plan everything, get holidays, and well, to arrange whatever what they need.
Yeah, and Madrid is actually the capital from Spain, which means that we have like daily direct flights from the East Coast. So I think it's a 9 hours flight.
Yeah, approximately.
More or less, yeah. So it seems very far, but it's not actually. And I think it's also important to mention that Spain is it's also like USA, that one of the best reproduction medicine in the world, actually. So, yeah.
Great. That's super helpful. Thank you so much.
Thank you.
So nice, Jennifer. Then,
yeah. So I guess we can start with the presentation.
Yeah, I think this is we have like a very different approach, right? Well, one is like Dr. Paula shows us the medicine side. Now, your side is just to help this patient.
Exactly.
To have to deal with all the stress and all the
emotions.
Yeah. So it's a lot to carry, right?
Okay, I'll go ahead and share my screen then.
Yes.
Okay. Here we go.
Okay.
I think you have to follow exactly.
Yes, that's it.
Yes.
Try it again.
Yeah, because she...
Got it now?
Yes, perfect.
Okay, perfect. Yes, so I'm going to talk about what I call a whole body approach to fertility. And obviously, when you're working with the fertility clinic, they're going to be focusing on your eggs and your ovaries and your uterus and your reproductive system. But as an integrative nutrition coach, I'm going to focus on other things. And so I often tell my clients that your fertility is more than your reproductive system. It's influenced by many factors, some of them which you can't control, but many which you can. So when I talk about this, whole body approach to fertility, we're going to talk about nutrition, which foods support your whole health and your fertility and which foods don't. And then I'm going to talk a little bit about some tips to manage and reduce stress and overwhelm, and then just a couple of quick lifestyle changes that support fertility. So when I think about the things that you can control, studies have shown the effects of food and nutrition on health and fertility. So nutrition impacts a whole range of things: your menstrual cycle, your ovulation. It can influence egg quality. It can influence the health of your uterine lining. And then obviously fertility, pregnancy, and prenatal health.
Okay.
So when we think about diet and nutrition for fertility, there are some overarching things that we think about. One is reducing inflammation. Inflammation is really, we're learning through science, the precursor to all disease. So we want to look at increasing nutrients, supporting, like I said earlier, your menstrual cycle, your ovulation, your uterine lining. We want to think about eliminating toxins that can disrupt your hormones, that can cause blood sugar imbalance, that can cause insulin resistance. Nutrition can help with egg quality. It takes an egg 3 months to mature before you ovulate. And then finally, last but not least, improving symptoms related to PCOS and endometriosis. Before I get into all this, I just want to sort of say who I am and what I do. I'm Jennifer Redmond. I'm an integrated nutrition and fertility coach. I've been working in the fertility field for more than 17 years. I've literally written and edited thousands of articles on fertility and infertility. And I've also had my own fertility journey and have been through fertility treatment. And I work with women to empower them to take a 360-degree view of their fertility. And I help them implement customized dietary and lifestyle changes. I'm often referred by fertility doctors to work with their patients as they're trying to conceive. I also work with women prior to fertility treatment. And I love collaborating with fertility clinics and doctors like those at Vida, because they really get and understand and are supportive of this whole body approach. So I've just got a few tips for you about nutrition for fertility. Number one is eat whole foods. I often like to say, eat the rainbow. So eat fruits and vegetables in a variety of colors for a variety of nutrients. So red peppers and purple eggplant and red beets, and those leafy greens are super, super important for so many aspects of health. So eat whole foods, eat the rainbow, get those leafy greens in. And then if you are going to be eating foods that come in packages, read the labels. Look for foods that you can actually pronounce in the packaging. You want to try and avoid things like fillers, additive, and chemicals. So tip number one is eat whole foods. Tip number two is eat healthy sources of protein at every meal. When I talk about good quality sources of protein, I'm talking about things like organic chicken. I'm talking about wild fish, those fatty fish like salmon. We're thinking about eggs, which are a whole source of protein. And then things like nuts, seeds, beans, legumes. There have been studies that have shown that if you eat a higher amount of plant-based protein, so things like those nuts, seeds, beans, and legumes, rather than animal protein, it's been shown to reduce the risk of infertility, including ovulatory infertility. That's number two, eat healthy sources of protein at every meal. And then tip number three is consider eliminating gluten. I will say that I have a gluten sensitivity. I have found that when I've traveled in Europe, I have no problem with eating gluten. It's the way that the wheat is raised. I think it's the way the sort of more natural use, less processed foods. So I'm very happy when I've been to Spain or I've been to France that I've been able to eat gluten. But here in the US, I don't eat gluten. It doesn't agree with me. A couple problems. Wheat, which contains gluten, is one of the 8 most allergenic foods and can cause a lot of problems, including inflammation and even hormonal imbalance. Research has shown that there might be a link between gluten sensitivity and infertility. Obviously, if you have celiac disease, you're going to avoid it altogether. But it's pretty easy to be gluten-free these days. You can just swap out grains, so using things like quinoa, buckwheat, even though it has wheat in the name, it is a gluten-free grain, millet, and brown rice. And I will say that if you are avoiding gluten, you do want to avoid the gluten-free aisle at your grocery store. A lot of the gluten-free products that you'll find packaged just have a ton of fillers and chemicals. You'll see a lot of sugar. So you really have to, in this instance and in most instances, really read labels. That's where getting back to eating whole foods is helpful. Stick with those whole grains and you're going to be great. So tip number 4 is to consider eliminating dairy. 60% of people in the US are lactose intolerant. That often shows up as digestive issues. getting stomach aches after you have a dairy product. A lot of people respond to the proteins in milk negatively. So there are so many these days, so many plant-based or nut-based milks on the market. Almond milk, oat milk has become really popular, cashew milk. So there are a lot of good substitutions for that. Dairy can be really inflammatory for some people, where it relates to fertility. Sometimes you'll see people who are sensitive to dairy might have problems with maintaining a pregnancy. There's sometimes, link between dairy and endometriosis. If you do choose to use dairy, I would say to definitely choose organic sources of dairy. So look for milk and cheese that's organic. One of the issues is that non-organic dairy often has a lot of antibiotics that are fed the cows and hormones for growth. So you definitely want to, if you are going to eat dairy, to choose organic. And then my last tip, if you are going to choose dairy, is to choose full fat dairy over low fat. There was a big study in the US called the Nurses Study, and one of their findings was that for fertility, you definitely want full fat foods over low fat foods, including dairy. So that's super important. And then tip number 5, and I know I'm talking about eliminating a lot of things, and I'm going to get to that in a minute. But sugar is a really big issue across the board with our health here in the US. The average American eats more than 100 pounds of sugar a year, which is sugar. Sugar can be inflammatory. It causes you those energy crashes. Like if you have, a couple weeks ago, I had an ice cream cone. I don't eat a lot of sugar, but I had an ice cream cone, and about an hour later, I felt like I needed a nap. It just causes those energy crashes. Sugar can certainly be addictive and can cause a whole host of health consequences. I work with clients a lot of times who say that they crave sugar, and that's something we can really work on together. I will give you a little tip that if you find you're craving sugar, drink some water. Dehydration can actually cause sugar cravings. It can also cause a protein imbalance. So where I said earlier about protein, good quality protein at every meal, that can certainly be helpful. Sugar can cause, like I said, those blood sugar spikes. It can cause insulin levels to rise. It can interfere with egg maturation and ovulation, which can certainly impact your fertility and impact success with IVF. And sugar's sneaky, right? I like to call it a hidden ingredient. It's got a lot of names: corn syrup, dextrose, glucose, high fructose. These are all sources of sugar. So again, really important to read labels. And if you go back to my number 1 tip, which is eating whole foods, you're going to cut out a lot of this. So those are basically my 5 tips. What I think is important, like I said, is I talked a lot about taking things out of your diet. This is something that you just don't say, all right, today I'm cutting out dairy, sugar, gluten, right? That's probably not very possible for you. What you can do, let's take dairy. Say you want to start with dairy. Cut out dairy from your diet for 3, 4, 5 days, up to a week. Really tune into how you're feeling, how your body is feeling, how you're feeling physically. And then you can add it back in and notice, have things changed? Do I feel different? Am I bloated? Am I congested? And that's how you can sort of start connecting the dots to see how food is really making you feel. And then if you've done that with dairy, then you can do it with gluten, and then you can do it with sugar, and sort of start to make some decisions about how you're going to proceed forward with how you're eating for fertility. So even just doing those simple things can really help you connect the dots. That is one component of a whole body approach to fertility. I want to talk briefly about stress and fertility. There's so much information about does stress cause infertility? It does not. However, infertility does cause stress. And then when we're going through this, we sort of get in this, this sort of cycle of stress and infertility, right? Stress triggers what's often known as that fight or flight response, which activates your sympathetic nervous system. It kind of puts you in survival mode. And that triggers your brain to release adrenaline. And then when that happens, your adrenal glands also release the stress hormone known as cortisol. For those of you listening to this, a lot of these terms might be familiar to you. And what happens is when you have chronic stress, which is also known as hyperarousal, your body stays in that fight or flight mode, right? And you're sort of always in that survival mode. So when you're in this chronic stress, it impacts your hormones. I've had a lot of clients who have said it's impacted their menstrual cycle, and studies have shown that. It can also impact the amount of time it takes to get pregnant. So your goal is going to be to elicit that parasympathetic nervous system, which is also known as rest and digest. Something that I read early on when I was reading and studying about stress and fertility is that the rates of anxiety and depression in women with infertility are similar to the rates of anxiety and depression in women with HIV and cancer. Which, and I share this with you because I want you to know that it's not in your head, that it's very normal, but there are ways that you can counteract it. So a number of ways to reduce stress. Meditation is a great one. There are a lot of fertility meditations online. I often will gift my clients and refer them to some great meditation series that focus specifically on the IVF cycle, or meditations for PCOS that can be really valuable. Breath work, so simple breathing exercises that you can do anywhere, anytime, that can take really less than a minute. Getting out in nature is a great way to reduce stress. Simply taking a break in your day, even a 5-minute walk, can be really calming and grounding. Movement, not necessarily intense exercise when you're trying to conceive, but movement, whether that's yoga or stretching or walking, can be a great form of exercise when you're trying to conceive, but also super helpful in reducing stress. Spirituality, some people might say that they have a relationship with God or spirit or the universe, or even meditation is a form of spirituality, but just connecting on some other level can be a wonderful form of stress reduction. There's also body work like massage, acupuncture, and Reiki. Acupuncture can also be helpful at certain points during your IVF cycle. There are great mindfulness techniques that you can do where you're really just present and in the moment and not distracted with electronics or your phone or anything. Maybe taking a mindful walk where you don't listen to anything, you're not on your phone, but you're just really observing everything with all of your senses. Yoga is a great way to reduce stress. And there are definitely yoga practices that are great for fertility, that are specific for fertility and for different parts of your IVF cycle if you're going through IVF. And then last but not least, developing a gratitude practice. Also a really great way to reduce stress. And I get asked all the time, what is the best way to reduce my stress? What is the thing I should be doing? And honestly, it's the thing that you're going to do consistently. There is no one that's better than the other. But if you can develop a practice where you're starting your day with meditation, or starting your day with breath work, or starting your day saying affirmations or prayers or some gentle stretching, whatever you can do consistently that's the form that I generally recommend. And then helping my clients, you know, develop a consistent routine, whether that's morning, whether that's evening. But I will say starting your day with something like that can really set a beautiful tone to your day. And then last but not least, I just wanted to talk about healthy lifestyle. I don't want to go on too long. I want to be mindful of everybody's time. But when I think about healthy lifestyle, one of the things I think about are reducing chemicals and toxins that you're ingesting, right?
Yeah, toxins.
There are chemicals in our food supply, unfortunately, chemicals in our water, chemicals in our air, household and beauty products that can all have an effect on your fertility and even IVF. You know, things like infertility, PCOS, endo, menstrual issues, and there, in some extreme cases, toxins and chemicals have been shown to damage eggs and increase miscarriage rates. So, not trying to be alarmist, just trying to bring some awareness. So, there are a group of chemicals that are called endocrine disrupting chemicals, and they are found in human tissue at very high rates. So these EDCs can be responsible for inflammation, for weight gain, for insulin resistance, endometriosis, some of the symptoms associated with PCOS like acne, irregular and painful periods. A lot of this can be controlled by reducing the amount of chemicals that we're exposed to on a daily basis to no fault of our own. So in your household, that's things like cleaning products, so trying to be aware of what cleaning products you use, reducing your use of plastics, such as water bottles, and even just opening your windows and getting some fresh air just to recycle the air in your house. When I talk to my clients about reducing chemicals from a day-to-day standpoint, things like cookware, you know, getting rid of some of those non-stick pots and pans that have chemicals that prevent the food from sticking.
This is interesting, huh?
You know, maybe starting, again, not an overnight thing, but starting to swap out some of those plastic storage food containers for glass. Beauty and skincare products, you know, when we think about things like what's in your soaps, what's in your shampoos, what's in the body lotion, think about your skin. That's the largest organ in our bodies, right? So reducing exposure by the products that we're using, trying to use some more natural products. And then something that a lot of women don't think about are menstrual products. There are a lot of chemicals in panty liners, pads, tampons, and wipes. So thinking about switching to some more organic products there, it's just something that many of us, you know, again, you don't know what you don't know, right? So but when you start to think about it, I'm starting to think about getting some more organic products there. So there are a number of places you can start. Many of my clients just start by swapping out their body wash and their lotions, you know, and then thinking about, all right, can I maybe stop using some plastic in my kitchen? Again, not looking to make an overnight change, but these small changes that feel manageable to you can really make a big difference in reducing the amount of toxins that we're ingesting. So that's what I wanted to share with you today. There are a couple of ways we can connect. My website is jenredmond.com. I am on Instagram and Facebook at Jen Redmond, INHC. If there are any questions, I'm happy to answer them. But it's been just so great to spend some time with you this afternoon.
Thank you. This was so interesting, Jennifer.
Oh, thank you. I'm so glad.
Oh my God. So well, you knew a lot about fertility and everything, but this was so specific.
Yeah, it's amazing.
It's
actually.
amazing, yeah.
Oh, good. I'm so glad. I'm so glad it was helpful.
Yeah. So, and well, actually, I have a question. Do you think that if I change to a healthier lifestyle, if I don't used to that, if that affects to the IVF treatment, or is it too like too abrupt? like it's a change too heavy for my body.
Yeah, so so when we make these lifestyle changes, it can definitely, I mean, one, it's just overall good health and wellness, right? But can definitely be helpful prior to an IVF cycle. I've definitely had clients who have come to me because they've had failed fertility treatment, and they're looking to just, and again, when I say that, there's no blame here, right? I'm not trying to blame people for the things that they're doing. But there are things we can do to improve our chances of success, like a healthier diet, like eliminating some of the toxins, like learning to just find some things that are going to work to help you reduce the stress so that the IVF cycle feels easier. It feels, you know, less stressful. Yeah, but definitely can help improve success rates.
Okay. And well, I think coffee and alcohol is like the toxic thing, no?
Coffee and alcohol, yeah. So I definitely say that if you're trying to conceive, it's a great idea to just cut out alcohol. Alcohol is also a huge source of hidden sugars, which I think a lot of people don't know. And then caffeine, you know, the jury's out on caffeine. A lot of doctors I've talked to say limit it to 1 cup a day. But if you can get it out of your diet, the added benefit of that is it's probably going to help with the stress levels too.
And what about decaf? It's actually a very common question that we have.
You know, it depends. Again, some of it's personal preference. I know different doctors have recommended different things. My kind of frame of reference is if you're going to cut out the coffee or the tea, I wouldn't do decaf. I'd say switch to an herbal tea. You know, that's going to give you some other really good things for your body. Sometimes the process of removing the caffeine isn't that great. So my general recommendation is to switch to herbal tea, and there are some great herbal teas on the market right now.
Okay. Well, and what do you think about like vitamins? I don't know, any supplements that you recommend to your clients, to your...
Yeah, I always recommend that if you're trying to conceive, you should already be on a prenatal vitamin, right? Because let's hope that the pregnancy is going to happen sooner than you even anticipated. So let's start getting those good nutrients in your body. I also recommend that my clients get tested for vitamin D levels. There's so many studies coming out, and I'm sure the doctor could speak to that, about links between vitamin D and fertility. And at least here in the US, many of us, most of us are vitamin D deficient. So it is a great idea to get your vitamin levels tested. Absolutely.
This is another reason to come to Spain.
Yes.
We have lots of vitamin D here.
Love that. I love that. I love Spain, actually. I hope the next time I'm there, I get to visit you all in person.
Yes, we really hope so. So great. Do you have any questions? No?
Well, no, it's been actually really helpful, Jennifer. Thank you so much.
Oh my gosh, it's absolutely been my pleasure. Really been my pleasure.
It's so interesting. Yes, we learned a lot today.
Actually, yes. Thank you.
Good. I'm so glad. I'm so glad. This is a lot of fun, and I really appreciate, Paula, you sharing all that information. It's so helpful to just understand what a cycle is going to look like, and then also if people are looking to travel abroad for fertility treatment, to know that some of the tests can be done at home. Is to get you started here in the US, and then transition to you nicely for the remainder of treatment. So
thank you very much, Jennifer, too, because I learned a lot today with you about the lifestyle, and I think it's very helpful. So thank you.
Oh, good. I'm so glad. You're so welcome.
So then, well, I think if you don't have any more questions, I think it has been a great webinar, so very useful information from both sides. So
Great.
Yes, so we can. Well, I really want to have another webinar like that. I hope that there are maybe more of them.
Great. I look forward to it.
So we're gonna, I think we're gonna do the, put the video on the,
On the social media,
social media, so everyone can see, and contact us with any questions.
Great. Thank you so much.
Thank you, Jennifer.
Thank you. Bye.
Bye.
Bye.